I'm Dr. Daniel Kantor, Neurology in Real Time, and I'm so happy to be joined here by Dr. Victoria Leavitt, who's Assistant Professor of Neuropsychology in the Department of Neurology at Columbia University Medical Center. At the recent meeting, you had a poster that had to do with fatigue and it had to do with aspirin. Tell me a little bit more about it.
Great, thanks, Daniel. I'm happy to be here on your program with you. So in my lab, one of the things that we're really interested in that kind of got me going in this direction, well, we're most interested in cognition and fixing cognitive impairment. And we had conducted an exercise study years back, and we realized that a big deterrent to exercise for a lot of people with MS is the overheating and the exhaustion that they feel. So everybody's familiar with overheating in MS. This is Untoff's phenomenon. We've been studying it for 130 years, right? We know that when people with MS get heated up, a lot of things go wrong. We know that it's a seasonal fluctuations in this as well. And lots of folks with MS describe the fatigue, right? The overwhelming fatigue that they feel when they get overheated. And so kind of bringing these elements together, we wanted to incorporate a cooling method that wouldn't be cumbersome or inaccessible. We know that like lots and lots of cooling treatments exist. We know that pushing people into ice baths or giving them, fancy garments to wear that sometimes are expensive, but we know that a lot of folks are like, this helps me. This is good for me. We wanted to try aspirin because aspirin is a miracle drug. It's, among other things, it reduces fever. It's antipyretic.
Okay.
And actually, back in the early 00s, there were two randomized clinical trials. One was done by Dean Wingerchuk at the Mayo Clinic, and he found that daily aspirin administration reduced fatigue in people with MS. That was 2005. In 2011, a group in Iran did the same study, led by a guy named Shayganajad. He found also that daily aspirin reduced fatigue in people with MS. And so we kind of took that and we put it into an exercise study, and we tried to see whether after being given a single dose, an adult dose of aspirin, so it's 650 milligrams, which is take 2 aspirin and call me in the morning dose, before people go, oh no, that's so much aspirin. It's not, it's standard, right? We gave them this dose of aspirin, waited an hour, and then had them engage in a maximal exercise test in our exercise physiology lab. And we found in our pilot study, we found that after being given aspirin, compared to placebo, because we brought them back on a separate visit and gave them a placebo, but we double blinded the study, so nobody knew at any time what
So you
pill
cross people over. So you cross people over. So everybody got the real treatment and everybody got the fake treatment.
Exactly. The beautiful gold standard model design, if you can do it. And we found that after being given aspirin, the reduction in body temperature increase was somewhere around 70%. It was a huge effect in a small pilot that we did in 12 people. The study that I was showing at Boston at AAN was a large-scale trial of the same. We were funded by the NIH to look at this in 60 people with MS. And here again, we found a huge decrease in body temperature increase after being given aspirin compared to placebo. We also found that for every single secondary outcome we looked at, which were different measures of exercise output, the people who had aspirin did better. And also they reported feeling less pain and less fatigue and less exertion after being given aspirin. So there were wallopingly good effects of aspirin.
Well, that's amazing, because right now, people who get oversensitive to heat, they have to do things like call up either the Multiple Sclerosis Foundation, MS Focus, or the Multiple Sclerosis Association of America, MSAA, and ask them about their cooling programs. And so there are cooling vests, and there's active cooling and passive cooling. There's cooling that's better when you're in high humidity areas like southern United States. So like in Florida, putting in ice pack inside your clothing is better than, say, dipping in the water and letting the water evaporate. That's just not as good in high humidity. But here you're saying something as simple as aspirin, which you can find everywhere.
Yeah, I mean,
actually were able to do their exercises better.
Right. And they also had lower heart rate at the end of their exercise session. they produced more watts, which is a measure of work. So they're doing more work during that exercise session with the aspirin than with the placebo. So again, like really encouraging. And the thing I like the most about this work is that I say to my patients all the time, just try it. You know, if you like it, if you feel good, if it works for you, it's available, it's inexpensive. Most of us have taken aspirin at some point, so we know whether or not we're going to have a reaction. You know, side effects are very, very minimal, except for the people who do have gastrointestinal effects of aspirin, which is, you know, if that's your profile. We actually incorporated a third arm, which was acetaminophen, and acetaminophen was also shown to be effective in all the same ways that I'm describing, by and large, but to a slightly lesser degree than aspirin.
So Tylenol worked a little less good than
seemingly, yeah. And that was that's I say that I want to temper the way that I state those results, because it was a secondary aim, and it wasn't, you know, we weren't putting aspirin head to head with acetaminophen. So.
But that's important, because although we talk about aspirin that you can go to every store and buy it, you can buy it at gas stations, it's not right for everyone.
Right.
Medicines like aspirin do work partially because they actually increase your bleeding potential. And so if you're a person who has a bleeding problem, that's something you obviously want to talk to your doctor, nurse practitioner, or PA about before starting it. So it's not right for everyone, but then there may be other options that we have to explore further. And what's the next stage for the research? Where are you going next?
So for me, the most interesting thing to do next is what I'm pursuing. And I want to know whether these laboratory results translate to life improvement. So I want to translate this from laboratory to life by asking the question of whether daily aspirin use increases free living physical activity levels for people with MS. To me, that's a meaningful extension of this work. But I'm curious if you have a better idea. I'm totally open to it.
No, that's a really good idea, because exercise, you have to set aside time for it. You have to be able to do it. And yes, I understand that exercise can be modified for everyone, but people are busy, and people perceive themselves as busier sometimes than they are in terms of finding time for themselves. So people might push off the exercise, and it might sound scary, but taking a daily aspirin may be helpful in reducing heart attack risk, potentially stroke risk, and then maybe make people be able to do activities of daily living better. So I think that'd be a fascinating avenue for the research.
Yeah.
And we really look forward to hearing more about it. I want to thank you so much for joining us here at Neurology in Real Time. And I want to thank all of you back home for joining us. Thank you.
Thanks, Daniel.